what to do whilst waiting for an ambulance. I'm Emma Hammett from First Aid for Life and onlinefirstaid.com. And generally, in normal times, the ambulance will try and be with you within 8 minutes. Now, these are unprecedented times, and the paramedics are absolutely at the edge and they are struggling to get to you. So it could be that you're waiting a heck of a lot longer than that 8 minutes. So first of all, ensure you really do need an ambulance. So we've got a separate article on Facebook Live on when to call an ambulance, just to help you decide when it is life-threatening and they could deteriorate and you need that help fast, that medical expertise with you fast, and when actually you're using them as a taxi service. So for example, if somebody has amputated a finger, many people would think that that would be an absolute no-brainer for getting an ambulance. But that person is not going to die from blood loss. They will need emergency treatment in a hospital, but actually you could get them there, providing you're not too jittery to drive and somebody can sit with them and support them so that you can safely get them to the hospital. So just think about it. The reason you're calling an ambulance, if someone is seriously ill and you need the emergency services to get to you fast with their expertise and their kit. So if somebody's likely to deteriorate on their way to hospital, then you need an ambulance. If somebody is unconscious and not breathing, you need an ambulance. If somebody is very seriously burnt, you would be treating them with your first aid immediately, but you may well need an ambulance. And if somebody is bleeding and you cannot stop the blood, can't stop the blood with direct pressure and dressings, you will need an ambulance and expertise. So the anaphylaxis as well, you need an ambulance. So there are key things when you need them, but if more of us aren't using them when we don't, then it's safer. Okay, so you do need an ambulance. So let's work out what you're going to do whilst you are waiting for that ambulance to arrive. So first of all, take a deep breath, clear your head, stay calm. The obvious problems are not always the most serious. So, for example, if there's a lot of blood, that might be a distraction for you, whereas actually it's more serious the fact that they're drifting in and out of consciousness because they've hit their head so hard and their airway is in danger. So they may not die from all the blood from a superficial head wound, but if their airway is blocked and they stop breathing, that is life-threatening. So keep focused, don't be distracted by lots of blood, because heads and faces in particular are very vascular and they can bleed and look very messy, and actually when we get to it, it really may not be that spectacular a cut. Okay, make sure you're safe from further danger, and so are they. First of all, check for response. If you get a response, so you speak to them and then you would touch them or pinch them, you want to get something that they're going to say, ow. If you get a response, if you don't get a response, you need to check if they're breathing. So you open the airway and check for breathing. If you do get a response, oh, excuse me, that's not COVID. If you don't get a response, you need to check if they're breathing. If they are breathing, you open the airway and you put them into the recovery position. If they're not breathing, you need to give CPR. And you give CPR by 30 compressions to 2 breaths. If it's a baby or child, you would give 5 breaths first to reoxygenate them. In COVID times, we are not giving breaths to an adult if we're a bystander. Obviously, if it's someone in your family, giving breaths will give them the best chance. And also, when you're checking for breathing during COVID times, we're not putting our face right above their mouth and nose. We are checking for breathing by looking for absence of normal breathing. If they are conscious, we would treat the most important life-threatening conditions. So bleeding, burns, go through. So bleeding, you'd apply direct pressure. Be ready if they're conscious as well. If they have a medical problem for which they have medication, you can help them to administer their medication. So if you think they could be having a heart attack or an angina attack, you would help them to administer their GTN spray and be ready, if that doesn't help, to help them take a 300 milligram aspirin, which they would chew. If they are having an anaphylactic reaction, you would help them with their EpiPen. If they are struggling to breathe and they're asthmatic, you would help them with their inhaler. And you would do all those things before calling for an ambulance. If they are struggling to breathe, it is always easier to breathe in an upright position than lying flat. Think of it yourself when you've got a really nasty cold. So upright and relaxed. For a heart attack, it's in a good position is a lazy W. So sitting on the floor upright with your knees bent up. If you know that there's a defibrillator somewhere close by and there is somebody else who could go and get it. So if you're near to a tube station or a train station or a huge supermarket and you have somebody else who can do that, they should phone for an ambulance and locate and bring back the defibrillator if possible. If you suspect someone's having a stroke, they need to get to a stroke unit as soon as possible. You would phone an ambulance, but if the paramedics, the ambulance control centre is saying that they are really strapped and they're not going to be with you for a while, then it may well be better for you to take them to the hospital, to take them to the stroke unit. Discuss that with the ambulance control centre. If their breathing is in danger, then you are best to wait for an ambulance. If they look like they're having a stroke and you are not far from a hospital and you can get them to the stroke unit there, then that might be your better option. If you suspect that they may have a serious spinal injury, you will need to wait for an ambulance and be very careful that you don't twist them when you move them. But their airway is still the most important to open and to make sure that you are maintaining their airway. And if they stop breathing, you are ready to give CPR. So I hope that's helpful. That's an awful lot of information in a very short crammed in Facebook Live. There is a far more structured explanation on our website in the blog, and there are far more bits of more detailed information on our website as well. So there's lots of free information available to ensure that you have the skills to be safe and know how to help. If you would like to come and join us for one of our first aid courses, we have practical. Yes, even during COVID, we run socially distanced training and we're COVID secure. We also have a superb range of online courses on onlinefirstaid.com and bucket loads of free resources too. So we can help you learn remotely or practically or online. If you found this helpful, please share it. And thank you for listening. That's Emma Hammett from First Aid for Life and onlinefirstaid.com.